Hello, doctors and friends. We are from Student Group Discussions B2. We'll present our student project for neuroscience and neurology system disorders called Clinical Diagnosis of Tarsal Tunnel Syndrome. This is our group members, and this is our presentation outline. Let me introduce myself. My name is Stella Angeline Isbianto, and my last three digits are 142. And now I will present about the background of our student project. So, tarsal tunnel syndrome or TTS is a posterior tibial nerve neuralgia due to compression of structures in the tarsal tunnel, and it is often underdiagnosed and sometimes misdiagnosed as plantar fasciitis. TTS is known to be more common in people with chronically swollen feet, such as people with diabetes or arthritis. And the causes of tarsal tunnel syndrome are varied, and 20% of cases are idiopathic. And the optimal treatment of tarsal tunnel syndrome is still a controversial issue because of its diagnostic difficulties caused by the poor diagnostic sensitivity of the instrumental exams that is used to diagnose nerve entrapments.
Hello everyone, my name is Veronika Wijaya with my three last digit of my student number 113. So the problem formulation for this student project are what is the definition of tarsal tunnel syndrome, the etiology who are at risk of tarsal tunnel syndrome, what is the pathophysiology, the clinical manifestation, how is it diagnosed, what are the differential diagnoses, how is it treated, what is the prognosis, and what are the possible complications of tarsal tunnel syndrome. The objective of this study are to understand the definitions of tarsal tunnel syndrome, the etiology, risk factors, pathophysiology, clinical manifestation, the diagnosis, differential diagnosis, the treatment, prognosis, and lastly, to understand the possible complications of tarsal tunnel syndrome. The benefit of study are students are able to understand the tarsal tunnel syndrome more in depth as one of the basic competences of this block. Students are able to comprehend the definition, etiology, risk factors, pathophysiology, clinical manifestation, diagnosis, differential diagnosis, treatment, prognosis, and the possible complications of tarsal tunnel syndrome.
Hello, my name is Aurelia Tabina Putri Wigianto with last three digit of my student number is 081, and I will explain about the definition and etiology of tarsal tunnel syndrome. First of all, the definition. Tarsal tunnel syndrome is a condition characterized by the compression of the posterior tibial nerve and its branches within the tarsal tunnel located beneath the flexor retinaculum. This compression leads to the development of symptoms such as pain and dysesthesia in the areas supplied by the medial and lateral plantar nerves. And then the etiology. Tarsal tunnel syndrome can be classified into two main categories based on its causes. First one is extrinsic, such as poorly fitting shoes, trauma, fungus or virus, post-surgery scarring, systemic diseases, systemic inflammatory joint disorder, diabetes. And the second one is intrinsic, such as tendinopathy, tendinostenovitis, perineural fibrosis, osteophyte, hypertrophic retinaculum, ganglion cyst, lipomas, neoplasms, and neuromas. That's all for me. Thank you.
My name is Elizabeth Thalia with the last three digits of my ID number 211. So now I'm going to explain about the risk factors of tarsal tunnel syndrome. So firstly, its gender. It is said that tarsal tunnel syndrome is more common in females than males, but the reason behind this is still unclear. The second one is age, that the older someone gets, the more susceptible someone is to tarsal tunnel syndrome. The third one is athletes. It is said that the athletic population, such as people who do strenuous exercise, such as running, jumping, sprinting, and weight bearing activities, have a greater risk of getting tarsal tunnel syndrome. This is because tarsal tunnel syndrome occurred in repetitive motions. The fourth one is surgery procedures. That one study explains that surgical procedures to correct varus deformities can cause tarsal tunnel syndrome. This is because the procedures include reduction of the tarsal tunnel, thus leading to the development of posterior tibial nerve compression. And the fifth one is other medical conditions such as hypothyroidism, diabetic mellitus, and rheumatoid arthritis that increase the risk of tarsal tunnel syndrome. The reasons are pretty similar because those diseases causing compression to the posterior tibial nerve, either by inflammation or swelling. That's all from me, thank you.
Let me introduce myself. My name is Nibbana Siva with the Statute 121, and I'm going to present the pathophysiology of tunnel tarsal syndrome. The main cause of tunnel tarsal syndrome is due to the compression in this tunnel, more precisely on the posterior tibial nerve, which causes the space for the nerve in this section to narrow. This narrowing of the tunnel will later manifest into clinical symptoms. The most frequently encountered cases are trauma cases such as ankle sprain. Post-operative injury and other compression lesion can also be one of the cases. Anterior soft tissue inflammation such as tendonitis and rheumatoid arthritis can manifest as tunnel tarsal syndrome. Deformities in the foot and certain repetitive movement like plantar flexion and eversion can also restrict the tunnel tarsal syndrome, tunnel tarsal, because this movement increases pressure in this area. Several systemic diseases which are also risk factor are diabetes mellitus, myxedemia in hypothyroidism, gout, and hyperlipidemia. Vascular disorders such as arterial and venous malformation and varicose vein are also the cause of tunnel tarsal syndrome. Prolonged vascular disorder can cause compression of the tibial nerve within the tarsal tunnel. Growth inside the tunnel, like cysts and neuroma, can also make the space to narrow down.
Hello, my name is Yovilia Tio Yunus and my last digit of student number is 035. Now I will explain about clinical manifestation of tarsal tunnel syndrome. The main complaint is pain directly in the tarsal tunnel. The pain then radiates to the arc and plantar of the foot. In addition, patients also experience dysesthesia, tingling or burning sensations, weakness in the leg muscle, sharp stabbing pain in the foot, radiating pain, and paresthesias along the distribution of the posterior tibial nerve, numbness of the plantar surface, and pain with dorsiflexion and reversion. The resulting symptoms are non-specific and vary depending on whether the entire posterior tibial nerve is compressed or if it is the medial or lateral plantar branches. That's all from me. Thank you.
Hello, my name is Happy Kusuma Mulya with the last three digits number 151. Here I would like to present the clinical history of tarsal tunnel syndrome. So, as a doctor, we need to examine the predominant complaints from the patients. There are pain radiating through the arc and plantar foot, sharp shooting pain, numbness on the plantar surface, radiation of pain along the posterior tibial nerve, pain with the extreme dorsiflexion and aversion, and tingling or burning sensations. So the physical examination should be done. There are atrophy, weakness of intrinsic foot muscles, and two contractures. The second is tenderness on the palpation of the tarsal tunnel. The third is gait abnormality should be analyzed. The fourth, sensory testing, strength and range of motion, and the physical examination can be done artinal and dorsiflexion aversion test.
First, let me introduce myself. My name is Danissa with the last digit number 005, and today I will present it about electromyography and imaging. So first, electromyography. Electromyography is still considered as gold standard until now, or diagnosing tarsal tunnel syndrome, even though the sensitivity and the specificity of AMG itself is still remain low. And for the finding that can indicate tarsal tunnel syndrome in electromyography are the finding of slowing nerve conduction velocity through the tarsal tunnel. And lastly, when using the electromyography, we need to remember to do a comparative study between the two limbs since the number of abnormal findings can arise the suspicion of tarsal tunnel syndrome. First, let me introduce myself again. My name is Danissa with last digit number 005, and now I will present it about the imaging. So there are two types of imaging that can help us diagnose tarsal tunnel syndrome, which is ultrasound and MRI. So both of them are useful to help diagnosing tarsal tunnel syndrome. But due to the location of tarsal tunnel that is still superficial, it is said that ultrasound resolution is far better than the resolution achieved by MRI. And for the ultrasound, it can help us giving us a clear picture regarding location of the nerve entrapment and about the cause of the nerve damage. So that's why the ultrasound finding of tarsal tunnel syndrome depends on the underlying disease that cause the tibial nerve to be compressed. But generally, ultrasound finding that can be found is thicker tibial nerve as it passes the tarsal tunnel. So that's all from me. Thank you.
Hello, doctors and friends. My name is Novea Indratmo, and the last three digit of my student number is 119. Now I'm going to be explaining about the differential diagnosis of tarsal tunnel syndrome. So, tarsal tunnel syndrome has a very wide range of differential diagnosis because the symptoms overlaps with other conditions. The first one being plantar fasciitis, which is the most frequent differential diagnosis because of the symptom plantar heel pain. The pain can happen at the same time with TTS or tarsal tunnel syndrome, so it can be a differential diagnosis. Second and third is tenosynovitis and also synovitis. They have similar symptoms, but both of them are not quite tarsal tunnel syndrome. However, they can lead to tarsal tunnel syndrome if it starts compressing, shifting, or adjoining the tibial nerve. The next one is radiculopathy, and the symptoms include pain, numbness, and tingling in lower extremities. There's also been a reported incidence between lumbar radiculopathy overlapping with tarsal tunnel syndrome, so it can be confusing between the two. Trauma can also be a differential diagnosis because injuries to the ankle and the foot, especially those in direct trauma or repeated microtrauma, can lead to the compression of the tibial nerve within the tarsal tunnel. And finally is neuropathy. So, for example, diabetic neuropathy can lead to symptoms like tingling, coldness, pain, and paresthesia, and the symptoms are worse at nighttime, which is just like TTS or tarsal tunnel syndrome. That is why imaging and electrophysiological assessments are very important to differentiate clinical findings to diagnose TTS. That is all from me. Thank you.
Hello, my name is Desylia with your last digit of NIM 084. I'm going to explain about non-surgical treatment for tarsal tunnel syndrome. So, non-surgical treatment or conservative treatment for tarsal tunnel syndrome mostly successfully relieves pain, inflammation, and tissue stress. This management include rest, activity modification, pain relief drug, corticosteroid injection into the tarsal tunnel to reduce edema, foot orthos, physiotherapy, and stretching. Pain-relieving drugs for tarsal tunnel syndrome include oral analgesic like acetaminophen and a non-steroidal anti-inflammatory drug. Besides that, gabapentin, pregabalin, tricyclic antidepressant can be used to treat neuropathic pain. Also, for physical and rehabilitation medicine modality choices for tarsal tunnel syndrome, including cryotherapy, changing to better fitting shoes or orthotic shoes, and etc. That's all from me. Thank you.
My name is Natania Faustine with the last three digit number 158. Now I will explain about the surgical treatment for tarsal tunnel syndrome. Surgical treatment for tarsal tunnel syndrome is considered most helpful to treat lesions that inhabit space within the tarsal tunnel. There are two events that indicate the need for surgical treatment. First, failure to solve the patient's symptom using conservative management, and second, a definitive identification of the cause of the entrapment. During the surgical procedures, the flexor retinaculum will be released from its proximal attachment near the medial malleolus down to the stentaculum thalli. Furthermore, the deep fascia of the abductor hallucis muscle will be sectioned to remove compression of any of the tibial nerve's terminal branches. Surgical treatment has varied success rates, ranging from 44% to 96%. Patients with a concise etiology, younger age, shorter history of symptoms, early diagnosis, no prior ankle pathology, and a positive Neuroscience preoperatively are most likely to achieve better results following surgery.
To ensure the patient's well-being, post-operative rehabilitations become a vital role of the surgical treatment. It affords protection to joints and nerves, as well as controlling inflammation and pain. The long-term objective of post-operative rehabilitation is to gain normal gait, walking, and running. Next.
Hello, my name is Komang Ayu Widhiani and my last three-digit study number is 044. And now we move on to the next topic, prognosis and complication of tarsal tunnel syndrome. The prognosis of TTS varies based on factors like its underlying cause, timing of diagnosis, and intervention. After surgery, outcomes can range from very good to poor. Early diagnosis and prompt treatment yield better results. Patients with symptoms lasting less than a year tend to have improved outcomes. Specific factors like diabetes history with a positive tunnel sign may not impact symptoms or nerve enlargement post-surgery, but can increase the risk of diabetic foot ulcers. Bilateral involvement worsens prognosis and raises the risk of diabetic foot ulcers. Surgical decompression can reduce ulcer risks but may not completely alleviate symptoms. Untreated TDS can lead to continuous pain, motor weakness, muscle atrophy, and limited foot movement due to chronic nerve compression. Postoperative complications include wound healing issues, infection, numbness, complex regional pain syndrome, and keloid formation. Complex regional pain syndrome and plantar sensation loss are major neurological complications post-surgery, and superficial hematomas are common. Recurrence of TDS can also lead to post-operative complications. That's all from me. Thank you.
Chapter 3 Summary. My name is Cokorda Istri Agung Sukawati and my name is 210251122. So the conclusion is tarsal tunnel syndrome or TTS is a condition found most commonly in women and elderly along with the other risk factors. The main complaint is pain and will worsen at night or after activity and will usually improve after rest. On physical examination, tunnel sign positive and phalanx phenomenon usually appears. There is no specific laboratory test for TTS. That is why, until now, when diagnosing TTS, connecting patient clinical history, imaging test, and EMG is still needed. For the treatment, the first thing to do is non-surgical and surgical for the last resort. The prognosis of TTS varies depending on its underlying etiology, as well as the timing of diagnosis and intervention. And for the recommendation, continued research in the field of tarsal tunnel syndrome diagnosis is essential. Future studies should aim to refine existing diagnosis criteria, explore novel diagnostic tools, and investigate the most effective treatment strategies based on accurate diagnosis. So that's all from our group, HGDB2. Thank you. Om Santi 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 Om.